Karen and Christopher are going to talk a bit more about what a health check is and how it should work, some top tips about health checks, and Christopher's going to talk about his experience of a health check. That also includes how to support someone to prepare for and have a health check, and what should happen after the health check as well, which I think is something that can get a bit confusing. We're going to say a little bit about reasonable adjustments. So reasonable adjustments are the changes that should be made to services so that disabled people can use them like anybody else. We're going to say a little bit about online health checks, because that's obviously something that's happened since the pandemic, and where to get more information. We'll have there'll be some slides at the end with and there'll be links, and you'll be able to see where you can get lots more information. And the information is based on what happens in England, because that's what we know. But of course, it actually, the reasons for having a health check and what helps about having a health check and what hinders about having a health check is the same if you live in England or Wales or Scotland. So we hope this will be applicable to everybody. Yeah, and so I just thought that you should also have a copy of the slides that were sent out with the link. So you should have them. Okay, so shall we just move on to the next slide? Okay, so just a little bit about why annual health checks are needed. So we know that people with learning disabilities may not be able to tell people how they are feeling, or not be able to tell them in a way that other people would readily understand. And they may not understand what they're feeling either, or understand that that means that you need to go and have a health check. So the idea of a health check was that, you know, that you have a yearly health check to pick up on any unmet health needs that the person might have that have not been picked up throughout the year. It's a joint health check, a joint check of a person's both physical and mental health. And we'll say a little bit more about what the health check should cover later. And everyone aged 14 plus on the learning disability register is entitled to one. So the change to, at one time it was for people who were 18 and over, but from 2014, which is actually quite a long time ago now, it was changed so that people from 14 years old could have a health check too. And there are some important reasons for that. One was about helping young people to get used to the doctor and the GP surgery, primary care. But it was also because we knew that some young people were getting lost when this thing called transition from child to adulthood. So sometimes people were getting lost to services, and then they weren't being picked up by health services when they were adults. So it was a way of kind of building a bridge, if you like. And just I wanted to say a little bit about the register, because that's also can be a bit confusing. So anybody who goes to a GP will be on the GP register, but the learning disability register is different from the overall GP register. It's for people who have a learning disability, and the idea of that is so that they can be identified and offered health checks, and indeed other reasonable adjustments. So we've got these two registers, and most GPs now do health checks. Not every GP, but most do. So I know it can be an issue in some rural country areas still, where people might struggle to get to a GP who does health checks, but generally people should be able to be with a GP who offers health checks. Okay, just moving on to the next slide. Right, so this is a little bit of a complicated diagram, so I'm just going to explain it because, again, the reason for doing health checks, it's about health inequalities. So that is people with learning disabilities we know do not always get the same access to services and other things, and that can affect their health. So if we look at the middle circle, that's about all of us in the middle and what affects our health. So that's, you know, what age you are will affect your health, whether you're, you know, what sex you are, and any conditions that you have. That can all affect your health. And then you've got what they call these individual lifestyle factors, but what that means is, you know, what you do with yourself, you know, what do you eat, what exercise you do, whether you smoke, whether you drink, all of those things will have an impact on your health, as will your social and community networks. So, you know, your friends, your family, people you meet in the community, all those things have an impact on your health. And then again, around the outside in a bit small writing, but it's things like, you know, where you live, what health services, whether you have a job or not, education, all of those things. So all impacts on your health. But what we know, and this is why it's about health inequalities, is that people with learning disabilities, well, and others, it's not just people with learning disabilities who have health inequalities or experience health inequalities, but if you don't have a lot of money, if you're living in poor housing, if you don't have a job, all of those things can affect your health, and that also affects things like who you know. So social and community networks, and that also affects what you do. So if you're living somewhere, for example, where there's lots of roads, and there are, you know, there's no parks, things like that you can go for a walk in, that's going to affect what you can do. So it's all interlinked. And say we know that people with learning disabilities are often disadvantaged in terms of some of these things. So you got, you know, don't have the same access to health services. They often people might often be reliant on having their support staff to take them somewhere, and sometimes, you know, that may not be available, and often have perhaps less in the way of social networks, and that will affect so that affects your health. So I hope that it's quite a complicated thing, but it's not just about you yourself, it's about you in where you live, who you know, what you do. Okay, so moving on. But you've heard enough of me for the moment. We're going to hand over to Christopher, who's going to talk about his experience of a health check.
Okay, we're on.
Hello. I'm a self-advocate, which means that I speak up for myself and on behalf of other people with a learning disability and autism. I am passionate about everyone having access to the best healthcare possible. I'm the co-chair of the North Health Task Group and I'm a member of the Belfast Health Alliance Learning Disability Healthier Lab Group. I'm a health and care champion working on organising BCM, Belfast Talking Media, and I'm involved in a lot of meetings and work hard doing proxy. I try to make sure that health and safety work with the government I was invited to my health check, annual health check by my GP practice.
So this story is from last year, isn't it?
Yeah.
This is your last last year health check, and that's important because we'll come on to something else in a moment.
When I arrived from my apartment, the receptionist tried to put me in, but when I avoided, I still on the list that day. For some reason, she said she would sort it out for me. Earlier than she did, and then she did.
Would you like me to take you out?
Because I've been very opposite and sick and stressful for some people, but I took it in my stride. During my health check, the doctor checked my weight, height, and blood pressure. Everything was okay with me. I was fit and healthy. I was very pleased with the result and went back home very happy. For me, it was very straightforward, but sometimes the doctor will make the health plan with you the plan of what you need to do to stay well and improve your health and well-being.
Lovely. So Christopher was really pleased that his results were good on that occasion, and it was very straightforward. But as he said, you know, it's not always straightforward for some people. And as he arrived at his appointment, there was a hiccup, and the receptionist said he wasn't down that day, but you know, he knew he was. So that itself could be very off-putting for people. Should we go to the next slide, please? Thank you. So the breaking news is that Christopher has just had another health check. So this appointment came up after he'd already written his story, his account of the last one. And this time, our local GP practices, they're working together. So lots of collaborative work. And they've made it a priority to invite as many people with a learning disability and other people whose health, who experience health inequalities, to come along to what they're calling pop-up community health check events. So last week, I was actually there with Christopher, and he allowed me to join him for his health check. And we took these photographs because we thought it was really helpful for other people that haven't necessarily been or who might be worried about going to see what actually happens. So in this case, the pop-up health check event took place in our local town, Skipton, in the town hall. And our little organisation that Christopher and I worked together on, called Exclusively Inclusive, we were asked to provide refreshments, and lots of the people involved in our little group, they or their family members helped to bake cakes. So we were able to offer homemade cakes, which were, okay, there were cakes, but they were nice homemade cakes, so they didn't have all the extras added in. And we secretly told people, because we made them at home, they were calorie free. That was just our little joke. But it just being in that much more relaxed environment, you know, not a non-clinical environment, really helped people to relax before their health checks. And at the same time, running alongside the health checks, the GPs also offered a pop-up vaccination clinic as well, which was slightly different. But what it meant was people were coming together in a non-clinical environment. People that were anxious could relax. And the first person that came and had a cup of coffee, first person I made a cup of coffee for, I think I was feeling a bit more nervous than he was, because I had to get the coffee right. But he didn't have a learning disability, but he told me that he was really nervous of having his health check, and he'd had them before, but for some reason this time he thought that it could be to do with COVID. You know, so post-COVID, everybody feels, you know, a little bit different, don't we? And he commented about the difference it made, you know, being in a non-clinical environment and being able to have a cup of coffee beforehand. He went and had his check, and he came back and sat down for half an hour and had another one with a piece of cake. So we just wanted to share this because we think it's a brilliant way. We haven't met anybody that came along over 2 days that didn't think it was a better idea than going to the doctors. And speaking to the clinicians, on the photograph with Christopher with the oximeter on his finger, the clinician there was telling us that the previous day they'd met people for their health checks that they've not seen for years because they've been too afraid to go to the surgery. So we just think that this is we think it's the future. So, well, I think we've really covered this bit, but just to kind of reiterate that the GP surgeries working together seems definitely to be the way forward. And anybody from any practice could go along on this particular day. You know, everybody was invited. So these are some top tips that Christopher thought about. And we thought we'd share them with everybody today. Spend some time thinking about your health and well-being before your annual health check. So again, you know, we know how important our health is. So just start to try and be aware of your own well-being beforehand. One idea is to think about your body from head to toe. And certainly for personal assistants or support workers, this is a really good way to support the person that you're caring about and supporting, particularly if for whatever reason they don't use words to communicate or they can't express to you what might be happening. So you could just work through their health from a head to toe perspective. Like Sue said at the beginning, remember, health is not just about physical things, but your emotional well-being as well. Talk to someone you trust to help you make a list of any concerns that you have. Because we all know what it's like when you're suddenly put on the spot and the GP or nurse or whoever it might be, could be a healthcare assistant that's doing your health check, you know, asks you questions and your mind goes blank. So it's a good idea to, you know, prepare beforehand and have someone help you think about it. Make an appointment at a time that you feel most relaxed. So, you know, if you don't function until you've had 3 cups of coffee, then, you know, make your appointment a bit later in the day or after lunch. Certainly somebody that I support, we always make the last appointment of the day and we think that that's a reasonable adjustment that he has that appointment, you know, because we will take a longer time and we don't want to be holding other people up because they'll be getting nervous as they're waiting in the waiting room. So, you know, just think about the best time for you. Think about what else you need to make your appointment easy for you. So we've mentioned reasonable adjustments, and I think Sue gave a really good explanation about what that is for people. But you know, it could be about time, it could be about having someone with you, or it could be, I think our next top tip, if you don't mind moving on, Karen, is thinking about chunking your appointment down. So some people might not manage the full health check in one go. So, you know, you could go along to your appointment and just have so much of it, the bits that you can cope with at that time. And all of these things are what we call reasonable adjustments to make life a bit easier. One person that I know, he has his health checks chunked down, but as a home visit, because that is the only way that would work for him. Ask a trusted person to accompany you to your appointment if you need. So Christopher actually didn't need help during his appointment, so that I went along especially for this presentation. but he could have managed that. But other people do need some support. Don't be afraid to ask questions and to ask the doctor or nurse to explain what they are doing and what they mean if they use jargon. Again, this is a really important tip, because I think we can all very easily get into the habit of being routine in our jobs and in our role and think that everybody knows what's going to come next or what's happening. So, don't be afraid just to say, hang on a moment, can you just explain what's going to happen? And I suppose if you've got a trusted person with you, that might be their role as well. Make sure you can understand the written health action plan and get help to follow it. So one of the things that Christopher and I are passionate about, as he said, is helping to reduce the health inequalities. Having the annual health check is just one thing, but it's no good attending that and it just being a tick box exercise. It's what happens afterwards that is just as important. So, if you need to take some action following your health check, you might need some help to follow that through.
And the health action plan really does help, because you can show it to your parent or carers when you get home, to save you having to try to remember your appointment.
Yeah. Excellent. Thanks, Chris. Yeah. So it's your health action plan acts in two ways, doesn't it? It tells you what you need to do, but it's also like an aid memoir, so you can show the people in your life that are helping you to stay as healthy as you can. Okay. So make sure you attend your appointment. So it is important to pick up any health concerns early so they can be sorted out. And I think, thinking back to the pop-up community health check event last week, when the clinicians told us that so many people that they'd not seen for years had attended. Sorry, I was just distracted by that comment up there. So, if we can make the health checks accessible, as accessible as possible, and reasonable adjustments are made, turn up if you can, or cancel if you can't, because everybody's really busy, aren't they? Yeah. So Christopher's final top tip was join your local self-advocacy group to have your say and influence change. So as he was saying, we have the pleasure of working with a number of different groups and organisations, and we all work together to make improvements in our area. So thank you very much. Anything else to add, Chris?
Yeah, thank you.
Next, we're having a little break to answer the questions. So we've got a few questions that have popped up. There was one about the health action plan, which we are actually going to cover a bit later, but it is a big issue. GPs should do a health action plan printout, and we'll show you an example of where one area has made that a bit more easy read, but of course what the GP produces won't be easy read, so it is down to the people that are supporting the person with learning disabilities to change it into something that is more understandable. But as I say, we will pick up on that a bit later. There was also a question about monitoring the GP performance, and there have been some great things in the chat about different things that people are doing, and I think that's, that there's some lovely projects going on, and I'm also seeing that people want to share things, but I think it is often down to what is happening locally, so in the southwest, we developed a very brief audit tool with the practitioners that could be used with GP practices, which was really more about supporting. It wasn't just an audit tool, it was about how we could support GPs. But it is variable across, across the country as to how GP performance is monitored, really. There was also a question about the GP register and how people get on that, and something about somebody's waiting for that to be verified. Now, again, I don't know the actual circumstances there, but I know that, I mean, in many cases, there'll be health facilitators or primary care liaison nurses who should be helping to verify those registers. So it might be worth talking to your local services or community nurse to find out what's happening there. There was also right at the beginning, I think people, the Welsh contingent, saying would we like them to share their research, and yes, please, that's great. I think those were the main things. Did anybody else pick up on any other questions that I've missed? Oh, the digital devices being used to check blood take samples. There was there are some or there was some work done on that. But I'm a bit out of touch with what's happened there. So if anybody does know and can put anything in the chat that they're aware of, that would be really helpful. We also did a reasonable adjustments guide to taking blood, which I think had that example in it. There was like a sort of doctor in a box type of thing, which was a very good way of doing it. I'll try and have a look at that, and then maybe we could send it out, because I'm sure we've got the link still to that guide, which has probably got that information in it, so we could send it out to you.
So I think there was a comment as well about the fee for a GP for doing the
yes.
checks.
Yeah, I mean, GPs do get paid for doing health checks. Yes, it's part of their contract. I don't know exactly how much it is now. I think it is about. It might have been increased a bit, but it's around the 130-ish mark. Yes, they do. Yeah. Right.
Just to say, I've just seen the question about the community clinic. There were senior nurses there, but there was a GP present at all times.
Right.
The question was it GP doing this, or was it the nurses from the GP practice, and was the staff was supporting? Yeah. So the GP was there, present all the time.
Okay. Yeah, that wouldn't be an uncommon model with health checks, that the nurse would do some of the health check, and the GP might do the other bit, or the GP would oversee. So I think that's similar to things that happen in other places. Thank you very much, Christopher. That was really helpful. Okay, so there's just one more question. There's practice gets a premium for having people with learning disabilities on the register. So they're paid to have a register. They're not. So that's, GPs work by contract, basically, and one of the contract is to have a register for which they will get paid. Yes. So thank you, and if you keep sharing what you know, and I think we probably need to move on to Margaret, I think, isn't it now? Yes.
That's right, Sue, thanks very much. Okay, so thanks very much, Christopher and Katie, for all of the top tips that you've shared about making sure that the annual health check is as successful as possible. And I think it's a really great way to sort of show how it's important to involve people in their checks. So it's really important to think about somebody's capacity to make the decision to have an annual health check in the first place. And capacity is very much about the ability to use and to understand information to make a decision, and then to communicate any decision that's made. So the first point in the slide mentions that if there's a doubt that the person is not able to consent to the health check, then this should be assessed and not just assumed. And the second point refers to reasonable adjustments. So you need to think about what reasonable adjustments are needed to be put in place to support that person to make the decision. So with any decision or proposal, you need to think about ways in which you're asking the questions, when you're asking it, do you need any communication aids to help? Are you the right person to ask it, and so on? Because we all know that there's so many things that can get in the way of people understanding what's been asked of them. So you must address this. For example, if somebody gets sleepy in the evening, then that's not the best time to ask them about their annual health check. It's better to wait until they're much more alert. Also, if they don't like somebody, for example, in the team, then that person is not the best person to ask them. So it's best to wait until there's somebody around who the person prefers or who they trust. Also, you need to think about how the person is communicating their answer back to you. Are you giving them your full attention? Are you using the communication methods that that person prefers? The last point is really about best interests. So this is where it's the case that a person hasn't got the capacity to make a decision about the annual health check, and therefore a best interest process can be used instead. So this would include getting people's views. So that would be from the person, from their relatives, close friends, other staff, other people who are important in their lives. But it's really the person's medical practitioner who will make the final decision in that person's best interests. And also just to note that sometimes as a result of a health check, a person may need to be referred for treatment or investigation or tests. Deciding to participate in treatment or tests or investigation afterwards are completely new decisions, and therefore they should be addressed separately. So it just can't be assumed that because somebody consented to a health check that they automatically consent to treatment or any sort of follow-up appointments. Katie, Karen, can we go to the next slide, please? So just thinking about some of the things that a health check can cover. So these are just some ideas. There could be a lot more. So things like, first of all, the person who's doing the check would need to know about the person in terms of their communication needs, and also thinking about how might they communicate pain or communicate stress. So during the appointment, they're going to look at a variety of different things, and that might include physical things and emotional things. So things might include a person's weight, their blood pressure. It might be about what the person eats, or do they drink enough. It could be about if they're happy or sad, how's their mood. Asking about their medication, is it the right medication for that person, or does it need to change? It might be about looking at specific conditions. So for example, if somebody had diabetes, they might want to check their blood sugar levels that particular day. It's also about checking about if their vaccinations and immunisations are up to date, and that would also include the flu vaccine. And it may also it may all include a review of the person's transition arrangements. This very much depends on the individual person, but clearly where somebody is moving from childhood services to adult services, this could be really important. The person doing the check will also be really keen to support the person to manage their own health. So it could be things like using information in a format that they can understand. So they may have leaflets or other tools to help the person to become much more involved and engaged in looking after their own health. So at the end, Sue's going to show us a link to some resources because there's lots more information available about things in the health check. So don't forget, as Chris mentioned earlier, there's lots of things to cover in the health check, so people might need it to be broken down into several different appointments. So what sort of things then should happen after a health check? So the doctor or the person doing the check will usually write the actions into a health action plan on their system so that they've got a record of it. They should give you a printed copy. However, that may not be in an easy read format, but it should say who will do what. So it may include things like tests such as blood tests or eye tests or hearing tests and so on. It might include other appointments like screening for cancer. So it may include things like mammograms, blood tests, scans, those kinds of things. And also advice on staying well. So it may include things about managing your weight, maybe stopping smoking, taking more exercise, So all the kind of things that you can help somebody to put into practice. So further to the check, it's really important to update the person's records or their care plan to make sure that everybody else who's supporting the person are aware of what needs to happen next. So this might include putting in dates in the diary for follow-up appointments, collecting new medication, and so on. So the next slide has just got an example from Cornwall of how they do their health action plans. And this is really just a way to try to make it a little bit more accessible for people. So many different areas have got their own different versions. This is one from Cornwall. So we go to the next page, please. So are there any questions so far on what I've been talking about?
There's a question about what would you advise when faced with a GP or other professional who doesn't seem to understand the importance of the Mental Capacity Act process. So I mean, it is the law. I think that's, you know, at the end of the day, it's not something that people can choose to take notice of or not. So I think it's very much worth making that point very strongly. There's lots of resources also that are online about the Mental Capacity Act that you know, that can be downloaded and shared to underline the point. So I mean, I think that would be your first way of tackling that. If people really, you know, it is because it's the law. You know, you can. If they're not taking any notice, it eventually complain. I've got somebody here saying health professionals are here. So you've got yeah, there are other professionals around who can also help to underline the message about the Mental Capacity Act. There was an issue about resources, I think, generally, and we will be talking about resources in a minute, and there's also quite a few resources that have been shared here. And I suppose one of the really important messages is do look at what is out there first, because there's plenty of resources out there, rather than start from scratch. So that you know, you can always adapt things you know, for your local area. Yes, so should GPs ask if they can have permission to include details onto the patient's summary care records? They should certainly be asking that. Yes, they should. So again, there are resources that explain that in a lot more detail that are in the resources that we will within the things that we'll share with you. So there's a kind of I brought together a summary of lots of resources, and the issue about the summary care record is definitely picked up within that. Other questions? Do GPs have specific training for people with a disability? Do you mean that GPs, do they get trained on working with people? Yeah, they should do. That should be part of their whole contracts in terms of providing health checks. And that's often provided by primary care liaison nurses, health facilitators, people like that. I mean, it can be difficult because sometimes if you've done the training, then you get a new GP starting, so there can be turnover, and it's not just GPs, of course, that it's important to train. It's also people like reception staff, particularly, you know, that can be an issue. So it's about training, I think, the whole primary care team about reasonable adjustments on working with people with learning disabilities. They should get trained. In reality, certainly primary care liaison nurses have talked to me about the difficulty with staff turnover, and then you suddenly, you've trained everybody and you suddenly get a lot of new staff, so that's difficult. There'll also be the Oliver McGowan training that is coming out, I think in the spring. Not quite sure when that exactly is, but then that should be for everybody should receive some level of training about working with people with learning disabilities. Were there any other questions that I haven't picked up on?
There was one point, Sue, I hope you don't mind saying, about the role of the support worker. And yes. I would just like to reiterate, really, yes, that the role of the support worker is critical, and support workers do need to be valued and upskilled, because they are the people that are often, in a supported setting at least, closest to the people. So, and it really is about truly getting to know the person that you're supporting and getting to know what is usual for that person, so everybody can, learn to recognize quickly signs that something isn't right. And there was just another point about the SATs and temperatures and other testings and during the annual health check. If you remember Christopher's photograph, he had his he had his SATs checked that day, he had blood pressure checked, and he had blood taken, didn't you? Yeah, so that happens certainly where we are, and even in the community setting, it happened there.
Was that just another hand that went up? It's gone down again now, so I'm assuming that's
sorry, it was me, but I was just going to talk about the pulse oximetry that was mentioned. But I do think I do leader reviews, and I think from that perspective, and you think about the respiratory deaths in people with a learning disability, there's been some really good pilots where people live, they're having the pulse oximetry regularly monitored, but you need to know what that person's baseline is, what's normal for them, and then early identification of, for example, a positive COVID infection. So I think certainly the pulse oximetry would be really key in the annual health checks. So you could see at least on a yearly basis, the GP could say, well, this seems to be the person's baseline. If things like having pulse oximeters in the home to monitor.
That's really helpful. I mean, I think there are a lot of projects now with things like Restore 2 and where you're we're working with so you've got community teams working with providers, understanding what's normal in terms of the physical presentation of that person, what their normal temperature is, which might be different from somebody else's, so that when things are starting to go wrong. So I think there's a lot of work on that. I think making health checks work really well, I think it's very much about partnership working and how we can support each other. So I think what can sometimes happen when things go wrong is it's easy to kind of blame the GP or the support worker or whoever it is. And where I've seen health checks working best, it's when you've got community teams, health facilitators, primary care liaison nurses, social care providers, self-advocates, families working in partnership together to make it happen. That's when it can really work well. But I would love to know how long it takes to actually get on. It shouldn't take very long to get on the register. Again, it'd be worth talking if you've got a health facilitator or a primary care liaison nurse or community nurse, it's not like a waiting list to get on the register. It's just, if you've got a learning disability, you should be on the register. There's sometimes just yeah, I can see being waiting since September. That shouldn't really happen. It shouldn't be a difficult thing to get on the register. So again, worth talking to your local services. I believe that health passport promotion should be signposted. Yes, I mean, there's all sorts of things that can help in terms of, you know, supporting people to understand their health, and also supporting other people to understand their health, which should all be part of that. And I've got some people I work with have been told they can't go on the register, they don't have a diagnosis. I suppose it's coming back to what are the reasons for having a health check, and the reason is about reducing health inequalities. So, you know, we know that sometimes people don't get access to services. People with learning disabilities don't get access to services like other people. So therefore, a health check is one way of kind of rebalancing that. And certainly I know in some areas, people who don't have perhaps a formal diagnosis but could benefit from a health check and want a health check are put on the register, but it varies from area to area. And I've also got how long should a health check take? It certainly should take longer than a few minutes. Again, it varies, and I suppose it depends a bit on the person and how long they need, but certainly I would expect half an hour to an hour for a health check. Yeah, GP practices need to respect support workers. Yeah, I agree. It's about, you know, everybody respecting each other and working together, is the point as I made. Yeah, getting on the learning disability register sometimes doesn't happen automatically, but you should be able to request it. So, and again, in some areas they've got you know, people like primary care liaison nurses who will work with the GP to make sure that you know, the people who should be on the register are on the register.
That's me, Sue. Thanks very much indeed. And there's some really good questions and comments coming through. That's fantastic. Okay, yeah. So I'm just going to go on and talk a little bit about reasonable adjustments. So we did talk a little bit about this earlier, but just to really think about some of the things that people have told us about reasonable adjustments in terms of things that did not help, things that got in the way. So some of the things were included where people didn't get a letter from their surgery, so they didn't even know when the health check was supposed to be. Sometimes people said that that there was a lack of support to go to the health check, and that's because there was nobody available to support them to go. So perhaps it wasn't put in the diary, or nobody was available, it wasn't put on the rota, or the right person wasn't available. And also sometimes what happens is that a temporary worker sometimes goes along with the person. They may not actually be the right person to go along to the health check because they may not know them very well. It can also not be a good time of the day for that particular person. For example, if they're a morning person, it's not fair to schedule their check for the morning, or it's not good to schedule it whenever they want to be doing something that they prefer elsewhere. People also said that they sometimes find that the receptionist didn't understand them. That can clearly make somebody anxious, especially if the receptionist is really busy and they can't take the time to try to understand the person. People said as well that they have to repeat themselves, and that can make them feel very anxious and they don't feel listened to. And also some people said that they don't like busy, noisy places and they prefer to be somewhere quiet. And doctors' reception areas can be noisy and busy, so that can cause a lot of stress for people if there's nowhere quiet where they can wait. Some people have also said that the doctor didn't clearly explain what they should do. Some people were given lots of information and they found that that was overwhelming and confusing. Some people said that they found it difficult to understand the doctor, especially if they used jargon. So most people aren't familiar with medical words, so it can be really confusing and anxiety provoking if you don't understand what the doctor's saying. And finally, somebody said, if they would take the time to explain things better, I would know what to do. So on the next slide, there are some examples of what people told us that could help them in terms of reasonable adjustments. So for some people, they said that easy read information can be helpful, or using diagrams or other resources. And it also helped when the doctor explained things in a way that the person could understand. It meant that the doctor understood the person, how the person communicates, and that they can communicate to the person in a way that was helpful for them. Some people said that they prefer other people to be there during the check. Some people said that it was good for the nurse to stay with them during the appointment. This could help them to feel less anxious, and it may also help in communication. And also, as we know, when somebody goes for a check, they see different people, such as a receptionist or a doctor or a nurse, as well as whoever is accompanying them. So people said that they found it really helpful whenever all the staff involved communicated well and took the time to help them. And also just knowing what reasonable adjustments are needed for each person is important, and also making them available. So for some people, it could be a quiet space to wait, or it could be seen at the times of the day when it suits them better, or it may even link to the gender of the doctor or the nurse or the healthcare assistant. It's about knowing what's important for each person. And finally, people said that having good support during the health check is important. That means that they're with somebody who they trust, somebody who will help them to speak up or to speak up on their behalf. Going to a doctor's surgery can make us all feel a bit anxious, so having somebody there to help to lower your anxiety is a good thing. So, just thinking about online health checks. On the next slide. Okay, so since COVID, many people haven't been able to go and see their doctor face to face. However, we do know that doing things remotely or online is possible. We've got evidence that for some people, not actually having to go to their GP surgery has actually been really positive for them. It means that they don't have to go and sit and wait in the surgery. They can actually see the doctor from the safety and the comfort of their own home. So there are some things to take into consideration, like thinking about, can some parts of the health check be done before the appointment? So for example, a person might have a blood pressure monitor at home, so their blood pressure could possibly be read at home. And also thinking about how can we actually prepare for the appointment, including any technology. So getting ready for the appointment may be things like including having people's records to hand. So it may be, for example, where somebody has got a weight chart because their weight has been a concern, or records of a special diet, or records of fluid intake, or any records of somebody's emotional health, and so on. And there could also be lots of other technology as well. We've heard some examples today about pulse oximeters to measure blood oxygen levels and different things like that. So there's lots of other resources, and Sue will talk about them later as well. So we put a link on this slide to a chap called Christian. Christian's written a blog that explains his experience of a lockdown health check, and it's an example of how a health check can be done online with follow-up, where he had some bloods taken. And it really shows how a health check can be done online, and some of the positive sides, such as being much more relaxed, and also the doctor being able to see where the person lived. So just going on to the next slide then. So this guide is on the NDTi website, and it's aimed at commissioners, GPs and health professionals. And essentially what it says is that annual health checks must still be offered despite any restrictions, and that if people aren't able to get to their surgery, then online options can be available. And it also suggests that some people will need to be prioritised. So that will include people who've had missed out on their checks, or people who are overdue on their checks, or where the person has had other significant health conditions or may have been to hospital recently. So Sue's going to talk us through some other resources that are available on the NDTi website.
Moving on to the next slide, I've muted myself, sorry. Okay, so we did a project about health checks and the workforce, and I think one of the ideas there was thinking about whether we needed to develop more resources. And what we know actually is there are masses of resources out there, and through interviewing social care providers, families, people with learning disabilities and health staff, we found that people didn't know about these resources. So they were all like, oh, you know, have you got, you know, have we got an easy read health check, you know, list, you know, checklist and all of this sort of thing. It, you know, it's all there. And you can take it and adapt it to your local area. So what we did is, or what I did with this particular document, which you've got the link for on the slides, is we brought all of the resources together, all the national resources that we could find, and some local resources as well. We didn't do all of the local resources because otherwise we'd have ended up writing something that looked like you know, the old telephone book. And of course people are also developing resources all the time. But what we've done is we've split it down into sections to try to make it easy for people to find these resources. So for resources for people with learning disabilities and families, for young people and families, for social care staff, and for GPs and other health professionals and commissioning CCGs. So it's split down so you can look at the section that is relevant to the information that you want. And what we've done there is also to provide a very brief description of each of the resources, so that you don't have to actually, you know, you don't have to click on the link to go and find out what it's all about. You can look at the description and think, oh, this might be for me, and then you can go, you know, you can look at the link again. It's designed to try to make it as easy as possible for people to find the resources that they needed. And there's videos in there, as well as links to you know, paper resources, easy read resources, and guidance and all sorts of things. So we hope that would be useful to people. And we've also suggested that people do look on their own local websites, because there are often local areas have developed their own resources that make reference to, you know, even with you know, contact details for primary care liaison nurses and things like that. So it's really useful and helpful if people, you know, have a look at what's available locally as well. So that's all there. And I think I just saw a link about the online health checks, and I think yes, there are concerns about the online health checks, but I suppose it was felt it was better than not doing anything. And again, when we looked at the you know, online health checks, we drew on really what people were trying out at the time. So that you'll see on the previous slide, a guide to health checks and the coronavirus, that there's actually examples from the 3 different areas that were trying things out, you know, because we were, you know, learning as we went at the time. It was all very, very new. So yes, I think we accept that it's not, you know, it wasn't the best thing to do, but it was better than nothing. Yeah, and I think, you know, we need to go back and start to, you know, to do more in terms of health checks, because yes, I think sometimes, and that's again another reason for doing these webinars, is that you know, to try to, you know, as one way of sort of hoping to sort of kickstart some of this again. Okay, next slide. Is that you, Margaret? This one? Or is that me?
Yeah, that's you, Sue.
Oh, is it me? Okay. Oh, well, it's just more resources, sorry. And that's just, so there's the link to the page there, and so as well as the booklet, which has got all the links to the resources. We've also done some basic guides to health checks, and again they're aimed at different groups. So and it's really trying to bring the information down into the main key points. So again, they're there for people to be able to print out and use as they want, really. And they say it's based on work we did with quite a lot of people from around the country about what they find helpful. Okay, so we're on to the final set of questions. Have people spotted things that I haven't in terms of issues that are coming up? Margaret or Katie or Christopher?
Sorry, I don't know if I've missed something here, but because I'm interested in the word entitlement, and but then not all GP surgeries offer the annual health check. So how does that play out? How does that entitlement come about when if you're registered with a GP doesn't offer it? What do you do? Do you have to go somewhere else, or you can't? Can you force the GP to do it? What underpins it? Most
GPs do them now. You can't force a GP to do it if they don't want to. What we've suggested for people, if they are registered with a GP who doesn't want to do or won't sign up to the health check scheme, is that you can move GP. But I do accept that is difficult if you're in a rural area. So, you know, if your nearest GP, you know, the next GP to the one you're registered with is over 20 miles away, that is difficult. You can talk to your clinical commissioning group about it and see whether they can persuade the GP. But at the end of the day, you can't force GPs to do it. But I say as far as we can tell from the data, most GPs now do offer health checks.
I think someone from MenCap was responding to my question, because I asked in the first segment about it, then it disappeared somewhere. That I think maybe they had something to offer on this. I don't know.
MenCap did some very good resources for around health checks. Called Don't Miss Out. So I don't know whether that was it, but that you know they were very good accessible resources. And again, it was a guide and a video clip. And I know there are some areas and self-advocacy groups actually who've put big pressure on GPs, which again is another way of which, you know, it was very helpful and actually did get some GPs to change their mind. So
yeah, so can I just come in there? Christopher and I would just like to just jump in there, because you know, don't underestimate the power of self-advocacy groups and the self-advocacy movement. And you know, when they're working alongside and co-productively with families and CCGs and so on, you know, we're a force to be reckoned with, really. So I think definitely Christopher's last top tip was join a self-advocacy group. And yeah,
join a self-advocacy group if you can.
Yeah, encourage people and families to do so.